I'm Dr. Carl Backer, and I'm the Chief of Pediatric Cardiac Surgery here at Kentucky Children's Hospital. The mission of our group is to take care of the children in Kentucky that need open heart surgery, and we've developed a joint program with Cincinnati Children's Hospital. Cincinnati, of course, is the #3 children's hospital in the country, has been for the last 10 years, and we're very honored and grateful to work with them. Our motto is one program, two sites, and we spend a lot of time working with the group in Cincinnati to ensure that we provide the best possible care for the children. So a little bit about me. I grew up in Wisconsin, northern Wisconsin. My father was an eye surgeon, so I learned early on kind of the joys and the responsibilities of being a surgeon. Actually scrubbed in with him on some of his cases when I was in high school. And firmed up my desire to be a doctor when I was an undergraduate at Northwestern University. Then I went to the Mayo Medical School in Rochester, Minnesota. And while I was at the Mayo Clinic, I was fortunate to work with some of the pioneers of open heart surgery. And at that time thought what they're doing is really a very special thing, and I wanted to try to do it myself. So I followed that up with a residency in Chicago at Northwestern, and did my general surgery training, then my cardiac surgery training, and then stayed on for another year at the Children's Hospital, which is where I had my first faculty appointment over 20 years ago, actually. So I've been doing open heart surgery now in children for many, many years. Well, Lexington, as you know, is located in the central portion of Kentucky, so we feel that we can offer care relatively close to home for a lot of patients from the Kentucky region. These patients, when they have open heart surgery, they don't go home the same day, so they're usually in the hospital anywhere from 3 to 10 days. And I think it's a lot easier for the families if they don't have to travel too far for that kind of service. We collaborate very closely with Cincinnati Children's Hospital, so we have conference calls with Cincinnati Children's 3 times a week. One of the interesting things for me is with the new normal, which is having Zoom meetings for everything. All of our meetings previously with Cincinnati were Zoom, but there'd be a bunch of cardiologists in one room in Cincinnati, and then we'd have our bunch of cardiologists in our room. But now everyone's Zooming in from home, so it feels really like we're all even more unified because everyone's on the same Zoom screen. We can see everybody, and it does feel very collaborative, and we're very happy to have their input into our patients. We give them input into their patients, and we decide, what's the best interest of each child, whether they should have their surgery here in Lexington or have their surgery up in Cincinnati. One of the best parts of my job is when I get to come out and talk to the families after we finished an open heart operation and tell them that everything went well and their child is doing well. And I feel comfortable that I'm bringing that child up to our cardiac care unit where I know they're going to get fantastic care, and really can see that they're going to be leaving the hospital in 3 to 5 days, so much healthier than they were when they came in.